Emergency services.
I need an ambulance. My son's just had a fit in the car and now he's gasping.
Okay.
Going blue.
Okay.
At Victoria's Emergency Communication Centre, a desperate mother is on the line.
How old is he?
He's 11.
11. Is he awake?
Yeah, he's got his eyes open, but
Okay.
he's gasping.
Is he still having a fit?
Yeah,
Is he breathing?
really struggling.
Okay, I'm just organising help, darling. Stay on the phone.
Come on, people. Push out.
Mobile intensive care paramedics Karina and Dodsey are on their way, lights and sirens, to the paediatric case. It's time-critical Code 1.
The patient was a preemie baby.
Roger.
If a seizure patient doesn't get immediate treatment, they risk brain damage, organ failure, and ultimately death. So every second counts.
No, everyone just
Steady.
one way or the other, people.
Is he still having the seizure?
He's not twitching, but he's gasping.
Okay, I'm going to need you to start CPR. So what you need to do is get him out of the car and lay him flat on his back on the ground.
Can you help him out of the car?
Just tell me when you've done that.
Got a friend helping out. Hang on a sec.
Just as fast as you can. We are organising help.
He's on the ground now.
So place the heel of your hand on the breastbone in the centre of the chest. You need to pump the chest hard and fast at least twice per second and 5 centimetres deep.
CPR in progress.
The goalpost just moved.
The most important thing to us is to get there as fast as we can to get there on time.
Keep going.
Dude, you need to stop so we can get through.
It really makes your heart start to punch a little bit faster when you go into this knowing that, you know, this could be a really bad outcome.
We're going to do it 600 times or until help can take over.
In Melbourne's outer east, single responder Cullen is also battling heavy traffic. He's been dispatched to an horrific road accident where a car and motorbike have collided. The motorcyclist is unconscious.
We need to determine whether the unconsciousness is due to a traumatic brain injury or whether he's bleeding from other injuries. This patient sounds critically unwell.
In the last decade, more than 400 motorcyclists have lost their lives on Victorian roads. Thousands more seriously injured.
It's insane, isn't it? We're on lights and sirens going 130 and he's weaving past us. We don't want another accident on the way to the one we're already going to. Okay.
Cullen arrives to a confronting scene. Emergency crews are already there. Fuel is spilling dangerously onto the road from the badly smashed motorbike. Multiple paramedics are attempting to save the unconscious rider.
So just to give you a quick handover,
Yeah.
GCS 3.
The news is chilling.
The GCS is the Glasgow Coma Score, which is a scale between 3 and 15 of the level of consciousness that a patient has. Someone who has a GCS of 15 is conscious, walking around, talking normally. A GCS of 3 is the next step towards death.
His BP was just under 180.
All right. He's lying there motionless, unconscious, which is a sign that he's got a significant brain injury. He also looks like he's got some internal bleeding. And my first thoughts are that this guy has a high chance of dying.
I need you to keep going with the compressions, okay?
Back at the Emergency Communication Centre, a desperately scared mother is on the line. Her 11-year-old son is gasping for air after a dangerous seizure.
So it needs to be at this speed. 1, 2, 3, 4. Are you doing that now?
Yep.
Good job. Count out loud for me.
1, 2, 3, 4.
A bit faster. 1, 2, 3, 4. 1, 2, 3, 4. Keep going. 1, 2, 3, 4. What was your name?
Jenny.
Jenny, you were doing a good job. We're going to keep going until we can get to 600 or the ambulance takes over, okay?
Left.
MICA paramedics Karina and Dodsey are receiving constant updates as they battle heavy traffic. But they're still at least a kilometre away, and every minute matters.
You are clear on these 3 lanes.
1, 2, 3, 4. Keep going.
Just wondering when MICA 30 are.
Yeah, we're only about a minute away, guys.
He's breathing. He's just gasping.
I need you to keep going with compressions, okay?
He's not looking.
Dude, did you even look, champ?
He's not looking.
You've got lights and sirens going. You're in a big white truck. Being a dad and having kids myself, that makes the whole thing more heightened. You just want people out of your way so you can get there.
Keep going. 1, 2, 3, 4. 1, 2, 3, 4.
Is he responding?
Oh, he's trying to sit up.
Oh, he's trying to sit up. Okay, that's all right. If he's trying to sit up, you can stop with the compressions. Good job. I'm just going to update the ambulance here. Just stay on the phone.
There's something on the floor here.
Doddsy and Karina are finally on the scene. After trying to get up, the boy is once again lying motionless on the footpath.
Hey, guys.
They're here now.
Okay, all right, good job, Jenny. I'll leave you with them. Bye-bye.
Goodbye.
Hey.
I look down and he's got that just had a seizure look about him, that confused, sort of dazed look about him. At least we know that he's breathing and he's still with us.
What's happened today?
Okay, so last night this little one fainted and he's been sick, and we've been to the doctor this morning. She's given him some meds to help with the nausea, and we've just picked up his brother from school and we started fishing in the back, and his eyes went really huge and he's gasping for air. So I pulled over and then called Triple O and he's just gasping.
Sure.
I got it.
What's his name? Thomas, wake up for me.
Mum and Dad?
No. Passerby who stopped.
good
Thank
work,
you
champ.
very much. Oh, Mum.
Yep.
His mum was pumping away on his chest, so just pulled over, and I think you'd do that for anyone. I'd hope someone would do that for one of my boys.
So Thomas was obviously prem at 24 weeks. Any other past history?
So he's got cerebral palsy, autism. He had the hole in the heart that's been replaced. He did suffer from pulmonary hypertension. He's had chronic lung disease.
So Thomas has gone through a lot of complications. Being undeveloped as a child would have led to some of these things. And that concerns me because it could be other things underlying going on for Thomas.
Thomas?
Perhaps another seizure or something else that's probably not quite right.
Thomas, wake up for me now. Wake up for me now.
Plan is straight onto the board, onto the bed, into the back.
In Melbourne's outer eastern suburbs, single responder Cullen has been called to a motorcyclist who's fighting for his life.
He's had 50 of fentanyl, 20 of ketamine, still quite agitated.
Thrown from his bike after colliding with a car, the critically injured man is now barely conscious and moaning in pain.
Somebody at his shoulders, somebody at his hips. I've got his head. 1, 2, 3, up.
Walk down the side.
Slowly.
Cullen suspects his patient has potentially fatal internal bleeding and a traumatic head injury.
We'll just start moving him into the back of the ambulance. I'm just going to jump in the side.
Loading and going, or?
We're just going to shut the doors, have a look at the injuries and make a decision, right?
Yep.
When a patient has a traumatic brain injury, we'll often put those patients into an induced coma to protect their brain from any further damage or secondary brain injury. But the drugs we use to do that can make the bleeding internally worse.
Is he still extensively tachycardic?
Yeah, so heart rate of 180.
It's a balancing act. If we intubate the patient or put them in an induced coma, it will protect their brain from further injury. But if we do that procedure, it may make the internal bleeding worse.
You then want hands?
Yeah, absolutely.
In an ideal situation, we'd have the helicopter available. They have bloods for blood transfusion and also have ultrasound to enable the flight paramedic to determine where the internal bleeding is.
If they're not in the air...
They estimated 25 minutes.
Yeah,
So I think we're better loading before you're going.
Yeah, let's just get everything stabilised.
It's pretty clear that this patient is bleeding to death internally. So we make the decision that we're not going to put the patient into an induced coma and head straight for the trauma hospital. Every minute, every second we're still on scene is time the patient is bleeding to death.
Look at the heart rate. Start going now.
Okay.
There's a saying in ambulance that transport is treatment, and this is one of those cases where transport to hospital could be the difference between life and death.
Go.
Thomas, squeeze my hand for me. Thomas.
After suffering a terrifying seizure, 11-year-old Thomas is still not responding to Karina and Doddsy.
Thomas. Take a temperature.
Absolutely.
He didn't have a temp or anything this morning, which surprised the doctor.
Well, he's certainly got a temperature. So he's 39.1 at the moment.
Whoa. Thomas.
Thomas.
Oh, you feel him, he's very warm.
Yeah.
1, 2, 3.
That's it, mate.
There we go.
Pop your legs up.
With his temperature now climbing past 39 degrees, Thomas requires urgent transport to hospital to find out the cause.
Honey, can you see hospital?
He's got a significant temperature, and so Thomas might suffer from epilepsy. He may have some sort of arrhythmia in his heart that's then caused him to have some sort of hypoxic seizure. You never quite know.
With his long history of extreme health problems, this is just another cruel blow for his mum, Jenny. The ordeal of giving her son CPR to try to save his life is finally hitting home.
I was in autopilot going through everything with the paramedics on the scene. But when they put him in the ambulance and I couldn't see him, that's when reality of what had happened all hit and I just burst into tears. I was terrified. I didn't know what was going to happen. I thought, oh my goodness, don't you die.
In Melbourne's outer east, a motorcyclist has collided with a car and is now fighting for his life.
Second dose of fentanyl.
Intensive care paramedic Cullen knows time is running out for his patient.
We need to be ready because we may have to rescue tube. We're traumatic head injury, so we're aiming for a blood pressure of 120 here.
With this patient, it's not just his brain injury that we're worried about. We're worried about his internal injuries.
Let's just have a feel of his chest. Abdo feels tight, okay?
Rigid.
Rigid?
Yep.
It's probably bleeding in his gut, I reckon.
We can't do anything for internal bleeding. That needs to be fixed in hospital and it needs to be fixed in an operating theatre. So we need to get him to hospital as soon as possible.
Stats are dropping at the moment. Heart rate's down to 124. I'm going to give him a bit more ketamine because he's writhing around. What's our location, guys?
10 minutes away.
As Cullen continues to work on his critical patient, he's starting to piece together exactly what happened.
White car was driving out the driveway.
Yep, and it flipped him.
Yeah, didn't see him. So he's gone into the smoke of the vehicle.
Yep.
50 km/h zone.
Yep.
His helmet was down 20 metres away.
Okay.
So the car's pulled out, just basically T-bone.
Yeah.
It's becoming pretty clear that it's amazing that this guy is even alive at all.
Every 10 minutes or so, he starts trying to lift his legs again. We just need to keep him semi-sedated, and we're almost about to pull up.
That's a good thing because this patient needs to be in surgery 10 minutes ago.
Cullen and the team are hoping they've made it in time.
It's always great when you have a good outcome, but deep down we know that we can't always do that, but we give it our best shot anyway. And it's why I wake up every day, and it's why I love being a MICA paramedic.
Cullen is one of nearly 600 specially trained mobile intensive care paramedics who are called out to the most serious cases. Trailblazer 51-year-old Glenice became one of the very first female MICA paramedics 19 years ago.
Every job you go to, you think, oh God, what am I going to do? And then you get into the job and it all flows and it's okay.
Exposure to the worst jobs has definitely toughened her up.
You just ask my kids, you know, they might come in and they've, you know, got a cut and they'll go, oh, Mama, mate, you haven't lost that limb? Get it, put a Band-Aid on it, go outside. Lose the limb, mate, or I'm not interested. Poor kids.
Those kids, Zoe and Lockie, are very proud of their pioneering mum.
I never noticed that women were in the minority. Never thought we were breaking the glass ceiling. And now we're almost at 50% and it's fantastic.
What time do you get back?
Tonight we finish at 10. At the moment, my daughter Zoe wants to be a paramedic. And I love that. I love that she thinks that Mum has a career that she might want to do. But as much as I've loved paramedicine, there has been dark times. And I don't want my daughter to see the world through my eyes sometimes. There's times I go home and you want to hug everyone. But then there's not too many jobs you can go to work and say that you've made a difference. And you do get to make a difference to people's lives. I always get teary because it's a good job.
Fall from rocks, multiple fractures, 18-year-old female.
Today, Glenice's first job is to help a teenager who's come to grief while taking a selfie on a rugged stretch of the Victorian coastline.
Tell me exactly what happened. Young girl just fell into the water. She fell off a cliff, pretty much.
She fell off a cliff.
Yeah, pretty much. It was like a couple-metre cliff into the water. She's pumped out.
Okay, we'll organise some help for her.
This is a 2-metre fall into water with fractures. Because I'm not sure where. You'd be thinking arms and legs. Those millennials will bloody die trying to do a selfie on themselves.
Extra paramedics have also been dispatched, but the patient's location is a tricky spot to get to. Glenice and the backup crew have been given access to a private road, but the team will still have to trek 1.5 kilometres in the sand.
Bruce, we're just going to have to take the basics, I think. Come to the beach, they said. It'll be great. Where are they? When I finally get to the beach and I realise she's not there and she's already trekked up that staircase, I just wish some patients would stay put where they were. Oh. On the plus side, if she's been able to walk up those stairs, it means her injuries might be a little bit less than what we originally thought. Hello. But if someone's helped her up those stairs and she does have a spinal injury, that could be quite critical for her.
This is Hannah.
Hi, Hannah. And when I first see Hannah, I see that she's shaking, she's struggling to talk. She's in a bit of a state.
Thomas, you're in an ambulance.
MICA paramedics Dodsey and Karina are on their way to hospital with 11-year-old Thomas after he suffered a sudden seizure in the back of the family car.
Mum's going to come down.
Jenny is following the ambulance, but is still in shock after performing CPR on her son.
I thought, oh my goodness, don't you die on the back seat of the car. I actually said to him, Thomas, you've got to breathe for Mum. Like, breathe for Mum, because this is not how it's going to happen.
Just going to do this again, mate. Yeah.
Paramedic student Maddie is on board today, and there's plenty of tension.
39.3, we're still on the way up. Absolutely frying.
Still hardly responding. Thomas's spiking temperature has them all on high alert.
And that's a big temperature to run up in an hour.
Get a bit of mist on him, perhaps.
Yeah.
With his temperature getting so hot, we need to cool him down, because even though he's had this one seizure and he's good now, doesn't mean that there's not something else going on underneath that could surface on the way to hospital.
Just trying to cool you down a little bit.
You look at an 11-year-old child that has a host of things going on with his autism and seizures and his hole in the heart. You can't help but think he's quite vulnerable in this time.
Just a bit concerned. Mum's in the car behind us, all right?
Thomas is a twin. They were born at 24 weeks gestation. He spent a long time in hospital, as did his twin brother. So it's been an ongoing journey for us since his premature birth. And the last 12 years with the boys and everything we've gone through has built up a resilience. But doing the CPR was just awful. And I'm very scared. Scared of medically what that means for Thomas.
So incredibly hot.
Yeah.
And he's white as the sheets he's lying on.
Very pale, isn't he?
Yeah.
Arriving in 30 seconds, mate.
You hope for Jenny's sake that they will find whatever cause is for his illness and that he's not diagnosed with some sort of longer-term seizure activity.
How are you going?
He says good. He's lying. He feels terrible. The poor kid has enough illnesses as it is, and Jenny has enough to worry about without adding that to it.
Paramedic partners Taz and Amanda have just started their afternoon shift, and they're responding to an unusual call for help.
We have been dispatched to a dog bite on nose. Patient intoxicated had gone out for a walk and come back with severe bleeding and nose split in two.
Nose is split in two?
Yep.
Our biggest concern when approaching a scene like this is obviously dangers. So dangers to myself, dangers to my partner. Is our patient safe? This guy's been bitten by a dog, so is that dog going to attack us?
As the paramedics approach, there is no sign of a dog.
Hello. Nasty nip on his nose.
But it's clear Mick is in a bit of trouble.
Can we have a look at your nose?
Yeah, it's there.
It is on your face. Can I pull the dressing away?
Oh, yeah, a bit off.
Okay, let's see the dressing. And
Oh, yeah. Yeah. Yeah.
Is it good or bad?
It's a good one.
He seems pretty comfortable despite this huge tear down his nose, which makes me wonder how much has he had to drink, because anybody sober would feel that pain.
I will.
A bit off.
Do you want to take it?
Oh, come on. Don't be f***ing.
I'm not being a p***y. Have a look at Taz.
look at this side.
Sideways.
No, that way.
Mick seems to be enjoying the attention.
No, we need to look this way.
This is my best side.
All right, Mick, I'm just going to take your blood pressure, okay?
Yeah, no, it's pretty good.
Yeah, I know.
Yeah, I know.
You think you can breathe from your mouth?
Yeah, is it bad then?
It's pretty bad. Was it a big dog or a little dog?
Oh, it's fairly a big dog. He went, rah! And I went, rah! And I went, bastard.
Okay.
And I went, bastard.
We know that we need to take Mick to hospital. But at the back of my mind, I'm also thinking Mick is under the influence of alcohol. And even though he's very cooperative, that can change any time. Are you in any pain?
Oh, yeah. Oh, God. You just wrap my face up and give me shit on the nose. I'm all in pain. Yes.
Okay.
I can't breathe. I can't talk. Yeah.
Hannah, how are you feeling now, love? Where's your main soreness?
My knee, my thumb, and my thigh.
Your knee, your thumb and your thigh. Well, let's have a look at those first.
On a rugged stretch of coast, a selfie expedition has gone horribly wrong.
So you've fallen off some rocks, have you, darling?
I got sucked off the cliff.
With a wave? OK.
MICA Paramedic Glenice is urgently assessing 18-year-old Hannah.
Let's have a little look at your legs, love. Oh, look at that. Geez, you've done a good job there. You look like you've come off a motorbike.
Hannah and her friend Emma had been trying to get pictures of themselves at a popular scenic spot.
So a wave came, we've both been knocked over and like holding on to the rocks that we can, but it's dragged her all the way out. Straight away screamed for help and there was blood. It happened so fast that it was just didn't feel real.
Does that hurt when you do that?
Yeah.
Is it sore around this region here? OK.
When someone falls and is bashed up against the rock by those waves, spinal injuries are a very serious consideration.
Is it sore for me to touch anywhere there?
Right there, yeah.
Not this side?
No.
But Hannah had no real injuries to her neck. She didn't complain of any central neck tenderness.
And then she was able to climb out of those rocks herself? You saw that? And then you walked her up here. All right.
And she basically has walked about 1.5 kilometres away from the scene. So we ruled out quite quickly spinal injury. But she's got quite a lot of superficial grazing.
Oh, my toe.
Your toe?
And she could have some fractures that we're not aware of.
We've got a large abrasion to the thigh, knees, just underneath here. So it looks like when we've come off the rock, we've glided all the way down on that right side. So we've got a lot of right side sort of abrasions. Have you ever had any pain release before?
Yeah.
She's got some great.
All right, this one goes up your nose. What I want you to do is go just a light little sniff, as I say. 1, 2, sniff. Good girl. Now, it should start to kick in about 5 minutes. Goodness me, look at those nails.
Now that we've established that Hannah doesn't have serious life-threatening injuries, I now have to consider how the hell am I going to get Hannah out of this location?
Are we going back the way we came?
Can you find me how I get there? Freeway.
Paramedics Nicola and Risky have been called to a sport and fitness complex in Melbourne's inner west.
Been dispatched to a health club for a 80-year-old female, initially unconscious, but now she's conscious and breathing.
It's always a good start.
That's all we have.
Okay. Wonder what an 80-year-old's doing at the health club.
Being healthy.
Except when she's not. Because we're
No, she
going.
doesn't sound very healthy, no.
I'm pretty impressed that someone of her age is even at the gym.
Clear both lanes.
Obviously, she keeps pretty fit and healthy, but unfortunately, that doesn't always mean that you're not going to have a medical emergency.
Yes, indeed.
Hey, Bruce.
How are you going?
Good, how are you?
He doesn't have a lot of blood pressure.
Yeah.
Intensive care paramedic Bruce is already on the scene, along with the health club manager. Eugene rushed to Joan's aid when she collapsed in the middle of her gym class.
So when I first got to Joan, she had a faint pulse, and as time progressed and her blood pressure dropped, you couldn't feel the pulse in her wrist. And we were pretty glad to see the paramedics arrive on the scene.
I think what we'll do, set up for an IV.
Yep.
So what I'm going to do, got the girls here to give me a hand. We're going to basically put a sharp needle in your arm. I think you need a bit more fluid. I'm going to give you that in a vein.
More fluid?
Yeah, you need more fluid.
At this point, Bruce can't feel a pulse, which gives us an indication that her blood pressure is below 80, and that's seriously low. And what that means is it can stop the blood from getting to her brain. She can become unconscious at any moment.
Darling, I do not know how you got up that hill. You did a very, very good job. It's got better lungs than me because I absolutely puffed my way up that hill.
MICA paramedic Glenice is trying to work out how to move the badly injured Hannah off a remote cliff top. The teenager fell down jagged rocks while trying to take a selfie.
You don't take any medications, do you, love? And she's in year 12 and we'd like to get back to those studies. Because what do you want to be when you grow up?
Nurse.
A nurse, OK. All right, you're going to learn about it today, OK, darling? Now that we've established Hannah doesn't have any serious life-threatening injuries, I now have to consider how the hell am I going to get Hannah out of this location? Because I've still got another 1.5 kilometres to the car park and I'm starting to think this is going to be a long trek for us. And then I look up and I see Parks Victoria's ute coming towards me over the sand dunes and I think we can hatch a plan for this. The cavalry's arrived. We can get her out somehow. Now, we've got a couple of options. We can put you in the back of the ute, but it's going to be very bumpy, or I think we're going to sit you in the front seat, all right? So I know it's going to be difficult transition getting you up to the seated position. All right, my love, can we have a few hands to help this young Hannah up? Okay. Now, let's stand you up first.
You're right.
You know,
you're right.
we got you. You were very lucky. We're all becoming selfie obsessed. We want that perfect post to put on Facebook or Instagram or Snapchat so we can show our friends what a lovely life we're leading. But in this case, rocks, waves and a big steep cliff. Leave that one alone.
1, 2, 3. Good girl.
Oh. Hannah, you are so brave. I think you've got some great war wounds to show your friends at school, OK? Good luck.
Hannah is fortunate to have survived, but she's still in severe pain. After being transferred to an ambulance, she'll be taken to hospital for scans to make sure she hasn't broken any bones in her quest for selfie fame.
Holy moly.
As for Glenice,
yeah, unfortunately.
She now faces a tough slog back to her car.
Oh, you passed me because I'm going really slow. Oh, this is the most exercise I've done in months. Come and resus me. I do remember saying to someone, just watch yourself as you're going up that hill because if you injure yourself, I'm not walking back up that track to get you. Oh.
So apparently she was unresponsive initially.
Do we know how long?
Oh, just a
brief.
77-year-old Joan has collapsed at an exercise class at her health club. Risky and Nicola are assisting intensive care paramedic Bruce, but they're struggling to find a pulse.
What was your name? Joe.
For whatever reason, you've had a collapse, you've got no blood pressure.
Helping out is health club manager Eugene, who's concerned about one of his favourites.
When I saw Joan, she was a little bit incoherent. She didn't know what was going on or what happened to her. Joan is extremely fit for a 77-year-old. She always come in with a positive attitude, so she's a big part of the club.
How much water have you had today?
About 600 ml.
You need more fluid.
It's a hot day, and although it could be related to dehydration, with Joan's age, we have to be concerned that it could be something far more serious and life-threatening, such as heart problems or a blood clot in the lung.
So I need to do a full assessment. It still could be your heart, I don't know. I need to have a good look at you. We're going to do a ECG, we'll do all of that in the car as well.
I'm not going with you.
Hey, Joan, How about you let us do a job? At the moment,
I'm sorry.
you've had a collapse, you've got no blood pressure, you're not fit to walk anywhere, all right? Okay?
We can't force people to go to hospital, but sometimes we need to use our experience and some firm language to explain to them that this is what's necessary.
Now, Joan, had to be a bit firm with you because we needed to assess you and your blood pressure's still quite low. You don't have a pulse at your wrist, nor do you have one here. So it's telling me that your blood pressure's very low. In my opinion, I really think you need to go for assessment, even if your number's normalised.
You going okay? The floor's not the most comfortable place in the world, is it?
I don't know, I haven't been down there before.
No.
So given Joan's able to have a little bit of a joke with me now, it makes me think that she might be a bit more open to coming to hospital.
Surprisingly, although Joan's flat on the floor, she's still putting up a fight about going to hospital.
I'm all right now.
You're not yet. Okay, your blood pressure is still not the best, okay?
So given Joan is apprehensive to be going to hospital, I don't think I'm going to be really relaxed until she's actually in the back of the ambulance and we're moving. That means that we've been able to convince her that that is the best thing for her today.
I can't force you to do anything, but I can bet you if you try to sit up or stand up, you're going to vomit and collapse again, and I don't know the reason that's happened.
No, I'm all right now.
Okay, let's take you to hospital, Mick. Get this nose fixed.
How bastard did he bite this?
Pretty bad. Needs to be looked at by a specialist.
All right.
That's all right. Let's go.
Yeah, I didn't know.
Back in the city, Taz and Amanda have managed to calm down Mick, whose nose has been ripped apart by a dog.
How much alcohol you had to drink today, Mick?
1 bottle of wine.
Do you drink a bottle every day?
Yeah.
Yeah? Is that pretty normal for you?
Yeah.
Okay. In this job with dealing with people under the influence of alcohol, then you never let your guards down. You know, you're always assessing the patient's mood and making sure that you're safe and they are safe. We're taking you to Dandenong Hospital.
How did this happen?
Well, you said that it's a dog bite.
Oh, that dog.
Yeah.
Mick's temperament is wildly unpredictable, so Taz tries to keep his patient calm by distracting him.
You haven't lost your accent, Mick.
No, I don't ever.
The only thing is I have to now learn English accent so I can understand you. Okay. Apart from the middle finger.
That's the same in any language.
I guess we can't please everyone, but we never give up. Have you got a family, Mick?
Yeah.
Got nothing to do with them? Okay.
Family.
What about kids? Have you got kids?
Yes, I've got 3.
Yeah?
I do.
They're not in touch with you?
No.
That's sad.
I know.
Yeah.
That's their problem, not mine.
Looks like we are at hospital, Mick.
Yeah, well, I still can't breathe.
Yeah, try to breathe through your mouth.
I do that anyway.
Yeah.
Otherwise I die, won't I?
To be a true paramedic, you have to show compassion.
All right, here we go. You get the gold class service.
I don't judge people and I give my best possible help to everyone, regardless of their circumstances.
You have to, darling. Did you see your nose? You've got to go.
Oh, well, that's the thing.
Oh, it's a pretty good cut.
Everyone ready?
Yep.
1, 2, 3, push up, push up.
77-year-old Joan has been refusing to go to hospital after collapsing during a fitness class at her local health club.
You okay? You got a headache?
No.
Let us know if you feel like you're going to vomit.
Risky and Nicola and MICA paramedic Bruce have finally managed to get Joan into the ambulance, but she's still not happy.
We can only do limited tests, but we need to take you to hospital so they can do some more thorough testing. And certainly, you're not in any state to go home at the moment, okay?
We need to help convince Joan that hospital is the best place for her, and sometimes patients don't realise how sick they actually are. We have to give them the hard truth. They could end up going home and dying. And that's extreme, but sometimes it's the reality.
I've been doing this for a good 27 years, and
You can trust me.
You can trust me. I kind of know what I'm talking about most of the time. I can't force you to go, but at the end of the day, Joan, if I let you go now, you're not going to be able to walk to your car and you're still in a bad state. I don't know what's going on. We don't kidnap people, Joan, okay? And we don't take people to hospital unnecessarily either, okay? Today, you need to go to hospital, okay? Okay? All right?
Happy?
Okay. Yeah. Obviously, you're a pretty fit lady, doing your exercise classes. How many times a week do you do those?
I used to go twice a week.
Yeah.
And then my partner got sick.
Okay.
And I nursed him.
Just on Furlong Road now, Bruce.
Yeah. Oh, you do?
I've had a lot to do with Sunshine Hospital.
So what connection do you have with the hospital here?
I lost my partner.
Yeah. Okay. I'm sorry about that.
Joan tells us that her partner got really sick and sadly ended up dying. It actually becomes a little bit more apparent why Joan has been a bit resistive to wanting to go to hospital. She spent a lot of time there when her partner was sick. You can totally understand why she's apprehensive to go back. But it's not really clear to us what's caused the collapse yet. The hospitals have a lot more tests that they can run to be able to determine what's actually happened. This could be heart-related, which is very, very serious for Joan.
It's now 4 weeks since Hannah was swept off a cliff while she was trying to take a specky selfie, and the experience is still haunting her.
All it took was for my friend and I to just turn our backs and this wave came. I just fell straight down the rocks and I had no hope that I was going to make it out. The waves were just way too big. First instinct was I didn't say goodbye to my mum, didn't say goodbye to my dad or any of my siblings. Is it ham?
No, it's chicken.
You're funny.
Ask for ham?
You're funny.
I know. I'm good. I definitely believe Hannah realises how lucky she was. What she went on through on the day will stay with her forever.
When Hannah got to hospital, she was treated for severe cuts and bruises, but luckily, no fractures.
Couldn't walk for about a week and a half. But, I mean, if that's all I was going to get, you know, the fact that I was still able to walk, that was good enough for me.
77-year-old Joan collapsed at her exercise class 6 weeks ago and needed plenty of persuasion to make her go to hospital.
Everything went black. I didn't want to go, but then I probably wasn't being rational, was I?
Having recently lost her partner Rodney to leukemia, Joan was fearing the worst.
When I heard how low my blood pressure had dropped, I thought I'm on my way to meet him. But then I thought, no, he doesn't want me to be there, so I'll stay where I am.
Luckily for Joan, exhaustive tests showed nothing sinister, and she's now back at aerobics, much to the delight of all her gym buddies.
Welcome back, Joan. Joan is extremely brave, she's stoic, and she always puts other people first, which is why she's such a big influence in our club and our community. Really glad to see you back in the club.
It's good to be back. You can't get rid of me.
Dog bite victim Mick did need extensive plastic surgery on his disfigured nose, but was allowed to leave hospital a week later with no lasting reminders of his ordeal. Cullen just got his critically ill patient to hospital in time. The motorcycle rider made a remarkable recovery after emergency surgery.
It never ceases to amaze me that some people survive these things, and what reassures me is that hopefully I've played some small part in that person, A, surviving, but B, having a good quality of life, and those two things are the most important things.
And when 11-year-old Thomas suffered a seizure in the back of the family car, his terrified mum gave him CPR while she waited for the paramedics to arrive.
Oh no! Oh my God! Bye-bye. Whee!
Hey, Today, Thomas looks perfectly happy playing with his twin brother Alex. But sadly, in addition to his cerebral palsy and autism, Thomas now has another medical battle to fight.
It turns out that he does have epilepsy. So if Thomas does have another seizure, at least now I'm confident that I can help him and get him through that.
Zoo barracks for St Kilda.
Mummy!
Dad Josh will be forever grateful to his wife for saving their son.
She's an amazing woman to be able to respond in the way that she did. Yeah, she's a real hero.
Big cuddle. Bradley family cuddle.